Good morning and welcome to Our Issues Milwaukee. I'm your host, Andrea Williams. Our focus this morning is on your health. The mission of the City of Milwaukee Health Department is to ensure that services are available to enhance the health of individuals and families, promote healthy neighborhoods, and safeguard the health of the Milwaukee community. And my first guest is the 16th Commissioner of Health for the City of Milwaukee and has served as the city's Chief Advisor on Health since 2004. Commissioner Bevan Baker. How are you?
Great. Glad to be here.
Glad to have you back on the show. And there are a number of things I'd like to bring to our viewers' attention this morning. But first, I want to get your thoughts on what are your main concerns when it comes to the health of citizens in Milwaukee?
Well, certainly, Mayor Barrett and I have a lot of public health priorities. Number one is taking care of our children and from mortality. But for this moment in time, we're really concerned about the growth of sexually transmitted disease in our community. It's one of my top priorities to try and hold that back. So we're working with a lot of people in the community to get ahead of that.
Wow. And with that said, the City of Milwaukee Health Department has a sexually transmitted disease and HIV program that's goal is to prevent the spread of STDs and HIV by offering preventative screening and treatment services. And if you would tell us more about that.
Well, it's important that everyone who's sexually active know their status. We're seeing a resurgence in chlamydia, gonorrhea, and syphilis, and we're an emerging center for HIV infection among men who have sex with men. And we're seeing gonorrhea rates like we haven't seen in the last 10 or 12 years. So this is really a sentinel time in our community.
Yeah, and one thing about it, Milwaukee has the largest public STD clinic in the state, and I'm referring to the Keenan Health Clinic on North 36th Street. Last year, they became one of the first STD clinics in the nation to actually have a new testing machine that can tell people their status when it comes to HIV right away.
Yeah, and I think that's a game changer for us. What we know now is that we can get information to individuals as soon as there's any evidence that they may have been impacted. Then it protects them, their partners, and their community in different ways. So we're happy to be able to put that piece of laboratory assay on the marketplace, and it's changing the way we can diagnose and treat people in the city.
So you're talking about these STDs, mainly chlamydia, gonorrhea, and syphilis, as you mentioned, really seeing those numbers grow, which is a scary thought when you think about it. So I think that the city of Milwaukee's ranked in the top 10 nationally?
Well, unfortunately, it's a distinction that we wouldn't want to have. I mean, in any other area, I'd be happy, but not when it comes to sexually transmitted disease.
Right.
We're fourth in chlamydia infection among the top 40 largest cities, and we're 11th among gonorrhea. And we're seeing that rate go up. And for HIV, particularly in that men who have sex with men, boys 15 to 24, we're seeing ourselves becoming an emerging epicenter. And that's something that we have got to get our arms around as a community.
And we're constantly hearing education telling people to know their status and to get tested. But why do you feel like these numbers are growing? Are people just kind of getting laxed in remembering how important it is to protect themselves?
Well, I think we live in a digital age. Things move very fast. I think there is some people who are lax, but at the same time, because advances in medical technology, we're not seeing people die and waste away from HIV. They're getting care. They can live with HIV their whole life. So people think the risk is not there, but there's so many other issues. There's the comorbidity of having one of these infections that increases and decreases your life expectancy. So we need to really get this message to our youth and to our entire community. None of us are safe until all of us are safe.
Yeah, and once a person is infected with the sexually transmitted disease, that actually heightens their potential of getting HIV, right?
Absolutely. Your immune system is part of a complex system of interoperability. So once you get one of these sexually transmitted disease, and then you're having unprotected sex, high-risk behaviors, then there's a good likelihood that you could become one of those statistics in terms of HIV infection. And we have to get that message out.
What seems to get everyone's attention is when it's broken down by zip code, age, and race, because it really seems to hit people at home closer. It makes that message hit them closer to home is what I'm trying to say, because the 53206 zip code continues to fall in those top numbers when it comes to many things that are issues in our city, but even when it comes to sexually transmitted diseases, correct?
Well, that's correct. I mean, we certainly look at the epidemiology of disease. Where is the disease happening? Who is it happening to? Well, let's be clear. Disease has no borders.
Right.
Someone in 53206 could drive to another zip code, have high risk, unprotected sex with someone else, and then they're infected. So disease has no borders, but we are seeing certain parts of our community impacted more than others. And I think we really need to focus. We go in where the fire is and try to put it out there. We need to educate people where they are, but be careful. Disease has no borders.
Absolutely. And I was just looking at the numbers broken down, and that's one that stood out. And then 53210 also stood out. And I feel that when people understand that this can affect an entire community if we don't pay attention and help spread awareness and get tested. This is why I have you here today.
Well, and you're right. And the social media, we can tell in a moment where people are, where they're convalescing. 30 years ago, it was bathhouses. Right now, it's let's get on a Twitter feed, let's get on social media, and let's have a house party. And in 20 minutes, we have people who are having high-risk behaviors and they're transmitting the disease. That's the reality on the ground. But we can fix that, and we have boots on the ground. We have people going into 53206 and trying to contact those partners of those who have been impacted by these.
And like you said, I do want to emphasize that it's not just one or several zip codes. There are just some zip codes that have higher numbers that definitely stand out. So you have this all Milwaukee Health Department clinics and 4-1-for-all sites that give out free condoms, no questions asked. Tell us more about that.
Well, I think this is part of our toolkit and our toolbox. You know, we have very successful condom distribution program. We've partnered with agencies like Diverse and Resilient who've done a great job with marketing and getting this out. So we will give someone a condom. What we want to do is to reduce a risk and then counsel people on high risk behaviors that they may be having. But going into a high risk behavior without one of your toolkits, one of your toolbox, which is a condom or barrier protection, is something that just got to happen. It makes good sense, and those programs have been very successful.
And there is a website, 414allmke.org, that gives more information.
More information, and look for the bus tells and look for the ads. It's a cute campaign, and I'm very happy about the youth who came up with that. It reaches people where they are.
I have seen it on one of the buses, so the message is definitely out there. And there is some good news in regards to health. The White House announced that the city of Milwaukee actually won the Healthy Communities Challenge. Tell us about that.
Well, Mayor Barrett took on the challenge from President Obama, who challenged 20 cities and mayors across 20 cities to see who could enroll the most people into the Affordable Care Act during the enrollment period. That's the highest percentage increase. And there were cities like Chicago, Atlanta, there was Houston, there were other cities who involved Detroit, and we were led from wire to wire. We were ranked #1 through every single time that they did the count, and Milwaukee won. And the winner of that challenge gets an actual visit from President Obama, so he will be coming to Milwaukee. You know, in public health, we looked at this as our Super Bowl.
Yeah.
You know, so we were like chest butting and high fiving everybody. You know, we got the president coming, so we're really excited about that. But it was a friendly competition that did so much to change the lives of people on the ground. You know, the 86,000 people are going to have access to affordable care that wouldn't have had it. So I'm excited about the president's visit, but I'm equally as excited about what this does to change the lives of people who didn't have access to care.
Absolutely, and we'll keep our eyes and ears open for when the president will be coming through Milwaukee.
It's a closely held secret, and I don't even know, but I'll be happy when we do find out from the White House.
Yes, and of course, Mayor Barrett delivered his State of the City address in early February, and during that speech, he announced that the city's overall infant mortality rate has decreased in every racial and ethnic group. So that, again, is good news.
It's good news. I think the mayor has taken a great leadership role there. He actually co-chairs the Life Course initiative with United Way to reduce infant mortality in the community. We still have to close the black-white gap. I mean, having those decreases are great, but until we can change that ratio between the number of babies who die before their first year who are black versus those who are white, that's what we really work on. We want to shrink that. There's nearly 3 times as many babies who are black who die before the first year of life as there are white babies. So we have to do more. But we have made strides. We've had a very aggressive campaign to address this issue. So, and it's our #1 public health priority, reducing infant death in our community.
And you've done a great job thus far. The numbers have really changed from, let's say, 10 years ago, and that's what you're working towards.
This is our mission. It's lifelong. And this is the most vulnerable population that we have in our community are our babies. We save them, we save Milwaukee, we save Wisconsin, we save our nation.
Yeah, and speaking of babies, co-sleeping continues to be a concern here in Milwaukee. Unsafe sleeping environments result in approximately 10 to 15 infant deaths each year, making it the third leading cause of infant deaths. So recently, the Milwaukee Health Department expanded its Cribs for Kids program with the help of Milwaukee Police. Fill us in on that.
Yeah, I think it's a great program. I'm really excited about the involvement of the Milwaukee Police Department, particularly a couple of precincts 2 and 7, where the Cops and Cribs program is a way to have our police officers who are in the same zip codes, 53206 and others, who are impacted by high rates of mortality. They're in those homes. They're making those calls. They're looking at public safety. And if they see a home where there's a baby and there's no safe sleeping environment, then they can do something about it. They can contact us. We can get a crib. We can get access, and we can help that family. So we need to have all hands on deck, and we have a great partnership with the Milwaukee Police Department. I'm excited about it. Cops and Cribs. It's a great program. I didn't come up with the name. I wish I had, but it works.
It works, and that's all that matters. The Milwaukee Health Department, along with many partners, actually give out about 1,000 cribs a year, and then you have a nurse that actually goes out and follows up to make sure that the families are using the crib correctly, right?
I think that has always got to happen. I mean, we have seen tragic cases where, well-intended individuals in the community can give someone materials, and then you don't give them the counseling or the support or the follow-up, and it sits there on the counter, and there can be a bad situation. So we want to have a relationship with that mother. There's a lot of things that a mother and a family have to deal with when there's a newborn in the house. What they need is encouragement and support, along with the crib or whatever they need to make certain the baby's safe.
Yeah, and you always like to reiterate the ABCs, which is for people to, when they are dealing with putting their child to sleep, remember to, one, have that baby sleep alone. So the co-sleeping, what we're seeing in the news is, maybe an adult sleeping with an infant, or maybe 2 older children with an infant, and it has had some tragic results.
It has, unfortunately, has some very tragic results. We want them to share the space in the bedroom, but not the bed. Have that baby close by so that you can attend to them. But when they're in that adult bed, things can happen. We don't judge anyone. We just look at the science, and the American Academy of Pediatrics says it's best to room share, not bed share.
Absolutely. And the B on that is to keep the babies on their back, C, in a crib, and S, in a smoke-free environment. I couldn't emphasize that enough.
Simple but powerful. Those are the ABCs. Isn't it funny how we can go all the way back to our youth and learn the simplest things in life are what matters? And if we can keep babies safe, then the ABCs are going to help Milwaukee move forward.
Yes, so we should mention if someone out there is in need of a crib, there is a number that they can call, 414-286-8620.
8620, and we will actually reach out to that family, that individual, and you can even refer someone else to us.
Okay.
And we'll go out, we'll visit, we'll make that assessment, we'll provide them with a pack and play, and hopefully help keep that baby healthy through its first year of life.
Now, there's one important thing that we have to discuss. Many of our viewers, like myself, may have been following this story out of Flint, Michigan, with the contaminated water. And I think that I was really surprised to see a story like this in the U.S. in the 21st century. The lead contamination, of course, is what I'm talking about. What were your thoughts when this story first became public?
Well, all of us in the public health community share the concern that infrastructure and what's happening in Flint was terrible. It was terrible for hundreds of thousands of people in that community, and the federal government, state, and their local government needs to work together. And this made everybody in the country look at their infrastructure as it relates to water and water quality. Let me first say this. Milwaukee is not Flint. The water that comes out of Lake Michigan has no lead in it. The water that comes out of our waterworks system does not have lead. However, if your home was built before 1950, you probably had lead service lines, and that's some of the concerns. So we have to think about what's happening in Flint, and it gives us an opportunity in Milwaukee to say, what can we do to make certain that our water quality and our water that's potable for the future is going to make certain that everyone's healthy.
Yeah, being proactive in every way possible. Now, it's my understanding that Milwaukee treats its water with phosphorus, so that kind of coats those older pipes and helps keep lead from being able to get into the water supply.
Exactly, and that's the important distinction. That did not happen in the case of Flint. They didn't treat the pipes, so it allowed the corrosion to happen and for all those elements to get into the water supply. Milwaukee's been doing that for many years. We meet all of the FDA standards, and that has kept our water safe.
Yeah, and we did have some water issues back in the 90s. I don't even like to say it. Cryptosporidium was an issue at one time, but from that point on, Milwaukee's water supply has been perfectly safe. But recently, Mayor Barrett did announce what you were just talking about. There are a number of older homes that have those lead service lines. Part of them are owned by the city, parts owned by property owners. You mentioned it's for homeowners who have homes that were built before 1950 that should be concerned. This is some 70,000 residential properties, and we're talking about $511 million to really take care of this ever been an issue.
Yeah, and let me just say this. This is not just a Milwaukee problem. This is a statewide issue.
Okay.
And I've reached out to people within state government to say that. We need to all work on it. Sherwood and other neighboring communities, they have the same concerns that we have.
With the older homes.
Yeah, with the older homes and the older infrastructure. But what we can do, there's some simple things that we can do. For instance, just if you're in one of these homes, just let the water run 2 to 3 minutes until it's cold. If the water has been sitting in the lines for 6 to 8 hours, when you wake up in the morning, just in the time that it takes you to wake up, just let the water run. And I think that we can do those types of things. And you can always call the Milwaukee Health Department or Waterworks, and we'll come out and we'll provide you with the information to make certain you can keep your family safe.
And you and the mayor are proactively working, like you said, with state and local officials to determine a plan to remove these pipes and help property owners figure out how they can pay their part of what it may cost.
I think that Mayor Barrett and Treasurer Spencer Coggs have done a great job at looking at that. The other thing I want to say is that there are 600,000 people here in the city, and every single day people get up and they drink the water. I drink the water, my family drinks the water, but we can always work together to make certain that we have a long-term safe water supply, and that's what we're trying to do, be proactive.
And since we're speaking of lead, in Milwaukee, childhood lead poisoning has been reduced significantly. Today, we're looking at a percentage of 2.7, and older homes with lead-based paint and old windows have been culprit, and so you have a program that actually helps people replace windows and things of that nature.
Yeah, our lead abatement program has been a national gold standard. We reduce lead hazards faster than any of the top 40 largest cities. We've gone from, as you said, about 32% of children being impacted by lead and lead poisoning to about 2.7%. So the number one source, the source that we're most concerned about is still lead paint in homes, and that's where children reside. We need to work with water quality and water issues as it relates to lead and infrastructure, but we still need to get the lead out of homes, and that's what our programs do, and we do a great job at that.
All right, so people can call and get information on any of the things that you've talked about today by either making a phone call, the phone number again.
Well, they can call Milwaukee's Health Department at 286-3521. That's our general number, and we'll patch you into whomever. People tend to call me, but there are great working people who can handle this. And I get too many calls, but I'm happy to take that call and get them to the right people. Our general number will handle that.
Well, I'm happy that you were able to stop by today and fill us in on all of these important issues. And I always love seeing your face. Thank you for coming by.
Thank you. These are our issues, and I thank you for getting them out there.
Thank you again. Bevan Baker is the Commissioner of Health for the City of Milwaukee. And for more information on anything we've discussed, you can log on to their website at milwaukee.gov/health. And when we return to Our Issues Milwaukee, we'll continue our focus on your health as we discuss an organization that works to save lives by improving lung health and preventing lung disease through research, education, and advocacy. We'll find out more about the American Lung Association in Wisconsin right after this.